Dr. Rogers, I'd like to present a patient to you.
Sure.
All right, so her chief complaint is shortness of breath. This is a 66-year-old lady. She has a past medical history of diabetes, hypertension, and COPD. She's coming in with shortness of breath for the past 1 day. So she's been complaining of this shortness of breath for the past 1 day. She notices she's been coughing a little bit more than usual, and she's tried a nebulizer treatment, which really didn't provide her much benefit. So on physical exam, she's afebrile. She has a heart rate of 110, and she's breathing at about 22 times a minute. And she's satting around 96% on room air. So her heart rate is a little bit tachycardic. She doesn't have any murmurs. Her lungs, they sound a little bit wheezy, and she doesn't really have any lower extremity edema. So I mean, the one thing for her I'm a little concerned about is I just really want to rule out a pulmonary embolism in her. So I just want to send her to the ER and check a CT angiogram.
Okay, well, let's talk about her a little bit. So first of all, excellent physical exam and evaluation. I definitely appreciate that. What do you think is her leading diagnosis?
I mean, to me it sounds more like a COPD exacerbation, but I just definitively want to rule out a PE because I know it's fatal, and we do it in the hospital all the time just to make us comfortable.
So I agree with you. I mean, we need to always consider fatal disease, certainly in patients, but what is your sense about what the likelihood that she has a PE?
I mean, I guess it's a little bit lower, but I still want to rule it out definitively.
Okay. Do you know any ways that we can quantify what her actual risk is of having a PE?
Oh, man, I haven't reviewed this since medical school.
All right. No problem. Well, let's talk about the Wells criteria. So actually, I have a little app on my phone where we can review. And so the Wells criteria allows us to compute a risk score and stratify her into low, intermediate, or high risk based on her clinical criteria. So you already told me that she doesn't have any symptoms of a DVT, and you already also reported that you think that she's having a COPD exacerbation. So no points for those, but she does get points because she's tachycardic. Does she have any issues with mobility or prior surgery recently?
No, she just went grocery shopping yesterday.
Okay, so no points there. Any past history of DVT or PE?
No.
Excellent. And any hemoptysis or current malignancy?
No.
All right, so her only criteria is the tachycardia, and that gives her 1.5 points. And we know that on this scale, that makes her low probability. So given that she's low probability, I think we should start with a D-dimer, because if that test is negative, that her risk of having a PE over the next 30 days is 1 to 2%. And a CT angiogram is an invasive test which involves dye, and so we certainly know that given her history of having diabetes and high blood pressure, we certainly could have some renal consequences, not to mention the radiation from the CAT scan. So what do you think?
No, that definitely makes more sense. I mean, I'm going to start using this more often. What's the app called?
It's the Wells criteria. So what I can do is this. I can give you a couple of articles on it. You can read it over, and then maybe next week in clinic we can talk about it.
Oh,
Does that sound
definitely.
good?
Yeah.
Okay. Let's go see her.